Our next presentation as we get back into programming is a science formatted presentation. Again, that's a research presentation by world leaders summarized by a patient-led panel. Now, this science session will focus on the conceptualization and measurement of episodic disability, followed by that panel discussion. When this session is complete, you'll be able to better understand the conceptualization of long COVID, a multidimensional, episodic, and unpredictable healthcare condition, and you'll have a better understanding on emerging data on the episodic disability experienced by people living with long COVID and how to measure episodic disability. Let's welcome in our presenter, Dr. Kelly O'Brien. Kelly?
Thanks very much, Jimmy. And thanks to Long COVID Physio for the invitation to speak today. I think everybody should now see the slides. First of all, I just wanted to start off to say I'm a physiotherapist. I'm at the University of Toronto in the Department of Physical Therapy, and I'm primarily a researcher. And I'm not a clinician nor a person living with long COVID. And my experiences in this area, and that I'm going to talk to you about today, has come from working in the field of HIV and rehabilitation, and thus more recently collaborating with the long COVID community. And it's been a really incredible learning curve and an honor to learn and engage in such rich collaborations from the community. So I'm very fortunate and appreciative to be collaborating with those living with long COVID and their allies in this work. So this topic actually was really sprung by and led by Darren Brown, who a while back started to think about the work that we had been doing in HIV and rehabilitation and how it might apply to the context of COVID rehabilitation. And Darren led this commentary where there were 6 lessons learned. And the ones I'm going to focus on today are the first around episodic nature, and then understanding that uncertainty is a key disability dimension. So episodic disability is defined as any physical, cognitive, mental, emotional health challenge, any difficulty carrying out a day-to-day activity, challenges to social inclusion, and uncertainty or worrying about the future. And these health challenges may be experienced on a daily basis, and that may fluctuate within a day, within a week, or over the longer term. In the context of HIV, we developed something called an episodic disability framework. And there's 3 features I'd like to share with you about this framework. The first is that disability is multidimensional. So it includes the physical, cognitive, mental, and emotional daily functions, challenges to social inclusion, and that includes difficulty fulfilling one's role as a parent, difficulty engaging in work or school, challenges maintaining or initiating personal relationships, and engaging in other social roles and activities. And the one circled here is this concept of uncertainty or worrying about the future, wondering when a next episode might arise and what the severity or long-term consequences it might potentially be. The second feature of the episodic disability framework is that disability or health-related challenges can be experienced as episodic. They might fluctuate either within the course of a day or over the longer term. And feature 3 is that these episodes can be exacerbated or alleviated by contextual factors. So when individuals talk about health challenges, it's not in isolation. There's also the things in one's environment or intrinsically within that may exacerbate or alleviate different dimensions of disability over time, such as accessing social support from friends, families, pets, partners, the community, support from accessing healthcare services and personnel, or program and policy support in the form of income or housing support. And then there's also an extrinsic contextual factor that may exacerbate disability, such as stigma. And we just came from a very engaging session earlier around gaslighting and the impact that has on one's health and function. And then there's living strategies. And these are the day-to-day strategies that one might adopt in their day-to-day life in order to mitigate or prevent episodes of disability from occurring. Things such as seeking social interactions and support from others, maintaining a sense of control over things that one can control, and trying to just block everything out of the mind, and maintaining positive attitudes and beliefs. And then these are also intertwined with one's personal attributes, such as age, gender, or other concurrent health conditions one may be living with. So this episodic disability framework was established originally in the context of HIV, but you may be thinking that there are some elements here that definitely apply to the context of long COVID. And if we look at the definition of long COVID that's been talked about a few times today, I've just highlighted some specific features around the multidimensional nature of that's featured in the definition, the element of individuals living with concurrent health conditions, and then at the very end, that these symptoms that one might experience may fluctuate or relapse over time, highlighting this potentially episodic nature. Now, there's been some work to sort of highlight or demonstrate this episodic nature in the context of long COVID. So this study sort of demonstrates here on the left side, fatigue, loss or change of taste, cough, and paresthesia, which may fluctuate over the course of time. And then how, on the right-hand side, the impact of that disability might also change over time and the level of burden that one might experience over time. Again, another commentary led by Darren Brown talked about conceptualizing long COVID as an episodic health condition. And this graph just demonstrates 3 potential examples of one's experience with living with episodic disability over time, this fluctuating, relapsing, remitting, dynamic, and potentially unpredictable nature of health. And the concept to take away here is that episodic is not an all or nothing, not a total health or total illness state, but it could be anything and everything in between. Now, the other bullet point from the lessons learned is around uncertainty as a key dimension of disability. And we've learned that there are a number of different aspects of uncertainty with respect to long COVID, not only disability uncertainty of when an episode might arise and the severity or duration of that episode or long-term implications on one's health, but also diagnostic uncertainty. For example, trying to have clarity in one's diagnostic, particularly for those who do not have a positive PCR test and some of the challenges associated with that, potentially accessing services. There's also financial uncertainty for those who have had to leave the workforce and have struggled or have been unable to return. Uncertainty among health and rehabilitation professionals on how to safely assess and treat individuals with long COVID. And then also uncertainty on the part of employers or human resource professionals as well as to how to facilitate a safe return to work. And so acknowledging that uncertainty in the context of COVID can have many different facets and complexities across those dimensions. Now, the measurement of disability, we've talked about over the course of the 2 days, how important measurement is. And in the context of episodic disability, it's important for assessing the impact of long COVID, where there's a need for services and support, facilitating or articulating one's communication of their healthcare needs around services and supports. It can help to facilitate goal setting, and outcome measures are particularly important for assessing the effectiveness and safety of different treatment interventions. And the field has started to generate a number of patient-reported outcome measures that have been used to assess function, symptom burden, the impact of symptoms, and also daily function and rehabilitation with the C19YRS tool, which we'll hear more about from our panelists today. And also, many of you may be aware that there's a long COVID core outcome set project that's looking to establish a core set of outcomes that one may consistently use across rehabilitation clinical settings, for example, when measuring health and function. I'm going to spend the last couple of minutes highlighting a research project that I've been had the pleasure of collaborating with in the context of long COVID and episodic disability, and done in collaboration with a number of different community organizations and groups in Ireland, the UK, the United States, and Canada. And the purpose of this study is to explore the experiences of episodic disability among adults living with long COVID and to establish a patient-reported outcome measure that we're refining from the context of episodic disability questionnaire originally established in the context of HIV. We conducted 40 interviews with adults in Canada, the UK, the US, and Ireland. And these bubbles provide some quotes of how participants articulated what their episodic nature of disability was like living with long COVID. The median age of these participants is 39 years, and the majority being female, approximately half unable to work at the time of the interview, and the majority had been living with long COVID for more than 1 year. We also asked as part of these interviews if participants might articulate by drawing what their experience was living with long COVID. And this is an example of one's daily fluctuations where they articulate within the course of the day, different periods of wellness and not so wellness over the course, and what some of those triggers are, or what some of those alleviating factors are, or living strategies in order to mitigate those disabilities. Here is another example on the left that shows the episodic nature of long COVID over a longer period of time. So a couple of years since March 2020, including where some episodes were experienced with vaccinations and the spikes and relapses and the clusters of symptoms that occur over time. And on the right-hand side, I think this graphic really nicely demonstrates the unpredictability of disability over time. As this participant stated, there is a part of moving forward, but also a part of moving back. And sort of really highlights that uncertainty. So we're at the point of taking the framework that will be established from these interviews and then refining the episodic disability questionnaire in order to measure presence, severity, and the episodic nature of disability. So in summary, the concept of disability in long COVID is multidimensional and episodic. Uncertainty is a key component and has impact on social engagement, work, relationships, and financial security. We have lessons learned from many of our partner conditions, HIV being one, is a foundation who's done a lot of work in this area around episodic disability. We know that measurement is critical of this concept, albeit not always easy, and that community engaged approaches are key. So I'd like to now just acknowledge everybody who's been involved in this work, because this has been an incredible team to work with. And now over to the panelists, Cathy, Natalie, Niamh, and Manoj, who are going to share their experiences about this concept. So maybe what I'll do is start by asking the panelists to introduce themselves and maybe share a little bit about what their thoughts on the concept of episodic disability, and does it resonate with them, and if so, how? Who shall we start with? Cathy.
Hi, everybody. I'm Cathy Thomson. I'm a musculoskeletal physiotherapist, and I've been living with long COVID since April 2020. I had a reinfection in February this year. I was on a phased return. I had about 4 or 5 phased returns, which I was on until I was reinfected in February, and have not been able to work since. My journey's been very bumpy. I've had daily fluctuations with my main symptoms, which are fatigue, muscle pain, cognitive dysfunction. And I've had 2 major relapses, one which took me 12 months to recover from, which was when I went back to clinical work on a phased return too soon, and the effort involved was too great. And I went from being able to walk comfortably for half an hour to being sofa bound for 2 months, not able to walk upstairs without any chest pain and difficulty breathing, and I couldn't cope with any sensory input at all. So the bumpy journey's been very characteristic of mine, and each time I've had a relapse, it raises questions of uncertainty of the future, which can be very difficult to cope with. I doubt whether I'll ever get to the point where I'll recover, be the person I was, return to my career. I feel a huge sense of loss of not being a physio at the moment, and also my identity as a mum, because I'm not able to do the same role that I used to.
Thanks very much for that, Cathy. Very articulate way of highlighting the episodic nature and the impact on social inclusion with respect to engaging in employment, fulfilling your role as a parent, and the uncertainty as well. Thank you for sharing that. Natalie, over to you.
Hi, I'm Natalie, otherwise known as Nat. I'm from Lancaster, a small town in the north of England where it rains a lot. I was a first waiver getting COVID in March 2020, so I don't have a PCR result to back my diagnosis up. Fortunately for me, that hasn't been a problem, and I have been able to access support. In my pre-COVID life, I was an assistant head teacher. I worked with the most challenging students, the ones that the education system had spat out. I absolutely loved my job, and in some ways I'm still grieving its loss. I tried desperately hard to get back to work, arranging a very prolonged phased return after much battle with HR, taking a lower income, going part-time. I tried everything to hang in there, but eventually I had to accept that I wasn't going to return to my baseline health, couldn't do the job I've been previously employed to do. There wasn't sufficient flexibility from my employer to allow my role to accommodate my new needs, and had to leave. So I don't like to take knockbacks sitting down. So while this has all been going on, I became one of the trustees of the charity Long COVID Support, which provides information, support, and advocacy for other people in a similar position to myself, and people who perhaps might not be able to advocate for themselves as easily as I can. I find myself often pausing to reflect on the fact that, on the one hand, long COVID has shrunk my world and taken so much from me. But on the other hand, it has enabled me to connect with this amazing community of people from whom I have learned and I'm still learning so much. And for that, I'm grateful. And I think this is also an appropriate forum to express my gratitude to the allied health professionals that have worked with me, my occupational therapist, my speech and language therapist, who have helped me to understand the episodic illness of my nature, to understand what impact that has on how I can go about my daily life and how to accept where I am at the moment, and maximize the tools that I do still have available to me. I don't know what the future holds at the moment, but I do know that I'm still present, and I still have a voice, and that voice can make a difference. Thank you.
Thank you very much, Natalie. You really nicely highlighted the role that community has had in the strength in terms of education and being at the forefront of generating, but also translating knowledge among the community and with other healthcare providers. And when we think about the framework in and of itself, I think that sense of support is a huge factor in terms of preventing and mitigating disability. So, Niamh, over to you and Long COVID Ireland.
Thanks, Kelly. Yeah. So I suppose I'm also a long COVID sufferer, working with Long COVID Ireland on a voluntary capacity. And I suppose I've been actually doing pretty well lately, personally. And as I say this, I've got my legs crossed, my fingers crossed, various things crossed in the hopes that I'm not about to hit another relapse like others here. So I suppose I sort of was thinking about some of the questions you put to us before we had this session, Kelly. And in terms of episodic disability, I probably wasn't alone when I went through my first relapse, which was in sort of late summer, early autumn, a few months after I'd had my initial infection, when I started Googling like mad to try and figure out what on earth was going on in my with my health, with my body. And when I wasn't getting, obviously, many answers from the medical professionals who didn't have any answers at the time. And what I found was I came across this wall of information about symptoms, about, with this disease, with this illness, you can have this symptom, and you can have this symptom or those symptoms with this disease or this illness. And as I was trying to figure out what was going on, I was saying to myself, okay, well, do you always have those symptoms, or do you have them just some of the time? Because I had that yesterday, but I don't have it today. So does that mean that I don't have this illness? But I suppose what kind of eventually kind of clarified, in my head, I suddenly realized, well, actually, when people are ill, because obviously I'd been really lucky up until that point, not having any major illnesses. When people are ill, they often don't experience that illness all of the time, or all of the symptoms all of the time. And in actual fact, maybe with some exceptions, I think maybe a lot of illnesses are really episodic. I mean, obviously, long COVID is probably exceptional in that there are so many extreme relapses, perhaps, but most long-term and chronic illnesses are really episodic. So that was kind of my one thought as we were talking about episodic disability and my own experience. And basically, it is the sudden realization that actually most illnesses are actually episodic, and most people have these phases where they may feel well for a week or for a short while, and then unfortunately they don't. And another issue was also learning resilience, and the importance of that for me, and having a lot of support on both social media and from my family in a time when we were all locked down and couldn't really socialize properly. Family for me has been hugely supportive. So those are kind of my two observations. If they're any use to people, I don't know if they are or not.
Thanks so much, Niamh. Really a great way of highlighting, as you said, some of the similarities with potentially other chronic episodic conditions. And the one of the lessons learned from the commentary was around taking a strength in numbers approach, particularly around policy and return to work programming and such. So, and I think you also really nicely highlighted, which leads to my question to Manoj, is, some days it's there, some days it's not. That's the challenge of how do we actually measure episodic disability, given its fluctuating and relapsing and remitting nature at times. So maybe Manoj, do you want to take things from there and talk about the measurement complexity?
Sure. Thank you, Kelly. So I'm Manoj Sivan. I'm associate professor and a consultant in rehabilitation medicine in Leeds, also part of the Leeds Long COVID Service, and one of the chief investigators of Locomotion Study, which is a network of 10 long COVID NHS sites. So in terms of measurement, as Kelly was referring to, right at the beginning of the pandemic, we were looking at actually the SARS and the MERS pandemics and the long-term outcomes. So that was kind of equipped us to predict what's going to happen with COVID. So we did the first UK study actually looking at long COVID symptoms, and it wasn't called long COVID then. So we came up with this scale, which is now called the C19 YRS, the Yorkshire Rehab Scale. And we've actually made an effort to capture this kind of the condition and its effect as such on a whole, on a person. So the episodic nature is driven by the symptoms, and at times it's also driven by the environment. So it's the whole thing. It's the interaction between the symptoms and the environment. So, and that is the WHO's ICF framework, which emphasizes the need on functioning the contextual factors and the symptoms. So the C19 YRS, somebody has thankfully posted it. I was trying to paste some other pictures in the chat, but it wouldn't come through. So the scale actually has got three components. It's got the symptom severity score. It has a functional ability score and an overall health score. So that actually pretty much reflects the ICF framework of WHO, because it's very important to measure not only the symptoms, but also the functioning, the impact the condition has, and the overall health state. And when we looked at the kind of the data we have, this sort of episodic nature is very classic. So when somebody has, say, mild breathlessness, they would actually score mild on every other symptom. So when you actually draw a graph of all the symptoms, they would be having, so there's a radar plot you can draw. That's what I was trying to actually paste in the chat, that when you draw a radar plot of all the symptoms, there's a ring of mild sort of symptoms throughout the symptoms. And when they have a kind of a relapse and all the symptoms are worse, then they go into the severe radar plot where all the symptoms actually track together. So there's this mild, moderate, severe, and the patient can see themselves. So we've got the scale on the app, and the patient can themselves see on the app how the long COVID is fluctuating from day to day and weekly basis and monthly basis. And I think that's very powerful for the patient. So traditionally, outcome measures are paper-based, and you complete the outcome measures, you leave that at the clinic, and patient hasn't got access to it, and you actually don't know what you scored. So I think we're going to change all that and make it very accessible, and hence we put it on the app so that the patient knows what they scored, has a visual impression of how their long COVID is and how it's changing with time. So as they keep completing, when they keep fluctuating between these, what we call the severity phenotypes or the episodic nature of the condition, they can see for themselves how the condition is changing. And more importantly, I think it gives them, if they maintain a diary, it gives them an idea of what are the triggers. So what are the triggers which making it worse? So that's you avoid those triggers or you modify those triggers. So it's a part of a self-management tool. So that was just about the C19 virus, and there are other scales, as Kelly mentioned, which probably do the same. I haven't sort of gone into depth of those scales, but my sort of message for colleagues here would be outcome measures you use need to be condition specific. I think, initially in the pandemic, people were drawing ill scales for every symptoms, for breathlessness a scale, fatigue a scale, about 10 outcome measures being used for the condition. I think that's clearly doesn't serve the purpose because it's one condition which is causing all these symptoms. So we need condition specific prompts, which we've got plenty, as Kelly shared in the slides. There are about 5 of them. So choose one of them. Choose something which is very kind of short, comprehensive, and more importantly, which can capture the episodic nature of the condition. Thank you.
Thanks very much, Manoj. And I encourage people to upload any of the tools that they've been using or such to the Padlet. And I saw a comment earlier asking about some of the research or evidence presented. And I've posted those papers in the Padlet, so they're all openly accessible. You can just click on the link and access them there. Okay, we have a couple of minutes left, so would love to do one last kind of roundtable. First to Cathy to ask, what should we be thinking about when it comes to episodic disability and future clinical practice, programming, or research?
A big area for me is around work and employment. The uncertainty and episodic disability nature with long COVID doesn't fit into the historic return to work plans, which tend to be time bound and graduated in terms of incremental return to tasks. We need to have a flexible approach, which is truly person-centered, which can allow for episodic changes and not goal-specific. So we recognizing that it's difficult for the employer as well. I've been asked, when do you think you can return to clinical work? And I can't give an answer because that's very uncertain. And creating a open communication is vital, I think, and creating a relationship where the communication is open, is honest, there are no surprises, the goalposts don't change. So I think this is something that we'll talk about in the workshop later on, but the policy around return to work, I think, is crucial.
Thanks very much, Cathy. Natalie, or Nat, over to you.
I think we need to re-educate society as to what it means to be disabled. For a very, very long time since coming unwell, I gaslit myself that I couldn't consider myself as disabled because I often had good days. I think we need to unlearn this misconception that disability is experienced as a static state, and we need to have a better awareness of the fact that for many people it's a dynamic experience with fluctuations of ability, energy, mood, and pain. It's impossible to accurately gauge what you're going to be able to commit to. And I think this uncertainty of not knowing what you're going to be able to do on any given day, not knowing whether you can trust in your own body, is what is so profoundly disabling about it.
Thanks so much, Nat. And over to Niamh, and we're in the last thick of things. So the final word is over to you, Niamh, and then we'll wrap up.
Well, I think I would combine what Natalie and Cathy said, and in terms of not gaslighting ourselves, but also within a society and social welfare supports, like for work, people's social welfare supports or social supports need to be there, and mindful of the fact that sometimes people can work and sometimes they can't. They may need help with housing. There's a lot going on for people when they are unemployed or can only get, part-time or keep part-time work as a result of being episodically disabled. So I think both of those things combine for a lot of people.
Thanks so much, Niamh. Manoj, 30 seconds left. Any final words?
No, I think I said it all before.
All right. Thanks. You've been very active in the chat as well. So thanks for posting the links to your questionnaire. Well, I just want to thank everybody on the panel today. It was a real pleasure. And thanks so much for all your collaborations and the work.